Hi everyone, today I'm here with Dr. Hoffman, a local endocrinologist who's been practicing in the field for over 20 years. She's also a faculty member at a medical school. And so before we start, thank you, Dr. Hoffman, for being a part of this interview.
Sure.
Before we get into the specifics, could you give us a brief overview of what endocrinology is and what it generally involves?
Well, endocrinology is looking at diseases that affect hormone-producing glands in our body. So probably the two most familiar processes to people are diabetes and then also thyroid gland disease. Mm-hmm. But it also looks at pituitary problems, adrenal gland problems, some of the issues that come up with ovarian and testicular disease, mm-hmm. and parathyroid glands.
What are the most common cases you see in a day? Is it mostly, I'd assume, a lot of diabetes?
Well, I did most of my practice years at Kaiser, mm-hmm. and because Kaiser is so large, mm-hmm. The endocrinologists did not do the day-to-day care for most of the people with diabetes. There just weren't enough of us. Mm-hmm. So we did do some diabetes, but they were patients who were kind of special cases or particularly difficult to manage. Probably what consumed the bulk of our days were thyroid issues, and specifically thyroid nodules. Mm-hmm. So I would do potentially several thyroid biopsies in a day.
Endocrinology is a subspecialty of internal medicine.
Right.
Are there any other ways to get there, or is that just the main way?
That's really the main way. I know there were physicians practicing who did their training in internal medicine, mm-hmm. and then just kind of built a niche for themselves, mm-hmm. in endocrinology. Mm-hmm. But most of us mm-hmm. did training in endocrinology and were board certified.
Okay, so are there further specializations in endocrinology?
Not for clinical practice.
Okay.
So there are people who are only focusing on diabetes. Mm-hmm. But I think that most people are general endocrinologists, mm-hmm. And will take care of any endocrine disorder.
Could you describe your path to medicine and endocrinology in particular? Why did you choose endocrinology?
Well, I actually did graduate work in physiology before I went to medical school, mm-hmm. with a subspecialization in endocrinology, and that was just kind of where things led me. And I really liked endocrinology. But when I started medical school, it wasn't with the intention, mm-hmm. of specializing in endocrinology. I didn't know what I wanted to do. I figured out pretty fast that I wanted to specialize in internal medicine. And so I did a internal medicine residency. And then I was asked to stay on for an extra year to be chief resident. Mm-hmm. And during that year, I started thinking again of what I wanted to do for my next step, and decided that I wasn't really interested in a procedurally based subspecialty, mm-hmm. like cardiology or GI medicine. And about that time, one of the faculty members for endocrinology who I had worked with came by my office and just asked me, have you ever thought of doing an endocrinology fellowship? And when he said that, it sounded really wonderful. And so I decided that must be what I should be doing, and so I did.
Could you walk us through a typical day in the life of a clinic day, from like the time you come in to the time you leave?
Well, Kaiser is very busy. We first started seeing patients at 8:30. I had a long commute, but I would try to get into the office before 8, if not at 8, and would start working on my email and reviewing labs. And then I would start seeing people at 8:30, and primarily I would see a patient, try and finish up my note, and then see the next patient. And I would do that till noon, and then spend my lunch hour catching up and doing emails and going over labs, and then see patients. And because I was 70% time, I would see patients till about 4:30 or 5, and then spend a couple hours just going over the emails that I hadn't addressed and lab results.
Okay, and so you mentioned you were doing 70% time. Were you doing something else, non-clinical things in the other time, or was that, were you working at 70% time to have more free time?
Well, originally I started working at 70% time. Well, part of it was that that's how much of an endocrine position they could offer me. But it also worked out for me because I had a baby at the time, and so that gave me a chance to spend more time with her, and I volunteered in her classrooms and went to all of her swimming matches and her soccer games. But then Kaiser got very busy, and so in the latter years, 70% time felt full time to me. And the time that I wasn't actually in the office, a lot of it I was spending on the computer, working on catching up with my work.
I'm not sure how your split is now, but obviously you've done clinic work, you do academic work and mentoring, things like that. How would you recommend people get involved in other things as a physician, whether in academia or like policy work or research or things like that?
Well, I think it depends a little bit on what your interests are. I wasn't really interested in going an administrative route. So at Kaiser, I pretty much stuck with clinical work. It's hard to get involved with anything else besides clinical work. There are people who do it. But really what I wanted to do is see patients. So I stuck with that. I feel very blessed to have my position here at the medical school because that gives me a chance to do teaching, and I wasn't really able to do a lot of that at Kaiser. But here that's all I do, and I really try. I'm very sort of territorial about my teaching time and make that my top priority.
So I guess realizing what you want and then prioritizing that in your schedule. Do you think big groups like Kaiser would work with you if you wanted to do other things, or you might have to fight for it a little bit?
So if I were still working there?
Yeah.
It really depends on the facility that you're working at. There's a real diversity in just the culture that's going on depending on the facility that you're at. There are people who get involved with research, but I would say that would be just a small percentage of the people who work there.
How does the lifestyle of a endocrinologist differ from that of another specialty?
Well, it's definitely different from the life of a surgeon. For example, we do take call, but our call is nothing like the call that a surgeon has to shoulder, or a cardiologist or a GI medicine specialist, because when they're on call, they're going to get called, and they're going to get called many times. Whereas endocrinology, most of our call could be handled by phone. And so it wasn't very often that we actually needed to go in and see a patient. And if we did, it would be someone in the hospital or in the ER. So we work hard and we work long hours, but it's just much different from some of the other specialties.
Are there certain personality types that do well in endocrinology, or would any personality type really work?
I think that you, maybe I should say, like to solve puzzles. If you go into endocrinology, With the exception of thyroid biopsies, we really weren't doing procedures. We were working with patients, hearing their history, ordering a few tests, and then making some recommendations. So we spent a lot of time putting what we heard from our patients together with the lab results, coming up with a diagnosis, and then treating it.
Mm-hmm.
So it's a lot of thinking.
Mm-hmm.
And so I think endocrinology requires someone who likes to think as opposed to perform procedures, because that's really what's emphasized. And that definitely matched what I like to do. So that definitely fit for me.
Okay, and so I've heard that a lot of internal medicine specialties, they tend to be more cerebral. This is just kind of like a side question. How much are things done kind of by the book or by the recommended guidelines, and how much are things done by like experience and intuition?
Well, it's really a combination, and we definitely followed standard practices. So that if you were to look up how we were treating a patient, if you were to look that up in a textbook or an online journal, we would be performing treatment the way you would read about it. But there's always an element of experience that you just can't get without actually having the experience. And so, seeing a particular type of case over and over again, you get to know the timing of it, the pace of the disease that the person has. You can anticipate things better than when you're just starting out. And that can feel like a big difference when you're practicing.
But what's the most rewarding aspect of endocrinology?
Well, I think it's a combination of working with your patients. It allows you to follow patients for a long time, potentially, and so it kind of feels like a private primary care practice in that sense. And you get to know these people, you get to know about their family and their jobs, and that was very rewarding. And then just practicing endocrinology is fun. I really enjoyed the problem-solving aspect of it.
What was the most challenging aspect of endocrinology?
I think it's that not everything ends up being black and white in endocrinology. So if you perform a particular test, what you read is that if you get this result, then it means this, and if you get this result, it means that. But in reality, the results aren't always clear-cut, and you may not be able to figure out what's going on with a person right away. It can be a kind of a prolonged, tedious process, and both you and the patient can get frustrated by that. Eventually, in most cases, you will solve the case, but it can take time. And I think that probably was the most difficult part.
How do you recommend getting into a good internal medicine residency and a good endocrinology fellowship?
I think a lot of it is a word of mouth, or at least a form of word of mouth, which is talking to mentors, your fellow medical student colleagues, and finding out where the good internal medicine programs are, and then the endocrinology programs. And I would have to go through that process myself if I were applying to internal medicine or to endocrinology at this point, because I'm sure things have changed since I did my training. But the bottom line is you need to talk to people who have that kind of information.
Going back to real quick employment types, you mentioned that you worked in Kaiser, which is like a bigger group type of setup. Do most endocrinologists work in bigger groups, or are there opportunities for like private practice or locums work?
I think it depends on what part of the country you're in. So definitely in California, there is diminishing private practice and solo practice in general, and certainly for endocrinology. And so at the very least, you're going to be in a group practice, but probably mostly in a group medical practice where endocrinology is one of the subspecialties that's offered. There is one endocrinologist who I actually first met and was mentored by when I was a medical student, and then ended up interacting with him through the years as I was doing my training. And I just heard that he may be finally retiring, but he really enjoyed being in solo practice, and he stuck with that. I'm not sure that solo practice even appeals to me, because I like to be able to interact with colleagues, run cases by them, get input from other people immediately, as opposed to having to call people.
And do you have any tips on managing finances as well as a resident or a new physician to maximize your overall income or financial status?
That can be difficult. Endocrinology is definitely not one of the higher paying subspecialties. So if you have heavy college and or medical school loans to pay off, that may at least partially dictate what kind of specialty you go in. Fortunately, I did my schooling and training through the University of California system. And although that's not cheap now either, it was definitely a lot less expensive than private schools. And I had loans to pay, but I was able to pay them off within a number of years without really having to bring in an extra source of income in order to accomplish that. I think the way that you augment your income is to work longer hours. That's probably the main one.
I was going to ask how well endocrinologists are compensated. You mentioned that they're not well compensated relatively. I'm assuming that's because specialties are often paid based on like doing procedural work rather than like intellectual or like communicative work. It seems like there's no real way to like increase that relative income besides working harder. Is that?
Yeah, I think,
besides working longer?
They have been working for a while to increase the income of primary care practitioners because they work very hard. We need them. There's a shortage of primary care providers, but I think the main way that they're going to increase the percentage of people going into primary care is to raise the salary of primary care. If someone has a really heavy loan debt, then that can't help but at least partially determine what specialty you're going to go into. And I felt very lucky that I was able to really pick what I wanted to do and not have to worry about money just to survive.
With endocrinology, it seems like since it is a specialty that covers a lot of different organ systems and things like that, there's probably a lot of advances. How do you recommend, or how do you stay on top of all those advances?
Well, there are two ways. One is to keep up with some kind of journal reading. I receive a couple of, they're like a combination of a newspaper journal on a regular basis, and that will have just short articles on research work that is currently going on, and so I can get a summary of things that are going on, and then if I have more time, I can go to the full-length journal articles and read them. And then the other way is to go to conferences, and of course that takes time, and depending on where you're working, you may or may not have a lot of time to spend on that. But going to the conferences will provide a way for you to kind of real intensely and real quickly catch up on new things.
Is that in protected time or is that on your own time?
Depends. At Kaiser, we got, I think it was a week of educational leave each year, which is very generous. And it was strictly for education, so if you didn't use it, it's not like you could exchange it for spending your time on vacation or something like that. If you're in private practice, then it's whether you're willing to give up that time seeing patients and bringing in income.
With medicine, endocrinology, or even other specialties, like the work and the study demands are pretty intense. How would you recommend preventing burnout?
Boy, I wish I knew the question to that. I think if you can find a way to augment your life with other things so that medicine isn't the only thing that you're doing, and I think that can take different forms. It can be spending time with your family. So, for example, when my daughter was growing up, I was able to spend time with her. I feel like I saw her grow up. Or other interests or hobbies, really pushing to have some reserved time for that. Or try and mix it up in what you're doing at work so that you're not doing the same thing day after day, because I think that leads to burnout. Sometimes it's very difficult to avoid it.
And on that vein, how would you recommend establishing a work-life balance? You mentioned that you were doing 70% time and then you had a baby around that time. So that was conducive to being able to have more of an active role in your daughter's life, as opposed to, I feel like a lot of physicians or kids of physicians I hear often struggle with not having enough time with their parent. So how do you recommend establishing that work-life balance? Do you think doing something like part-time work, or maybe like 50% full-time or 70% full-time the best option, or are there ways to do it even going like completely full-time?
I think being able to work part-time is probably the best option, and then you fight really hard to protect that time that you are not being paid for and actually spend it at home with family or whatever it is that you want to do. If you're working full-time, then you're really obligated to take care of all the patients that is required of you. And it's very difficult to scale back the time that you need to put in to do that.
So the best thing you'd say is probably cut down your work time?
Right.
Okay, and so were you pregnant in residency, or?
I was pregnant in fellowship. In fellowship,
okay. And so was that difficult to do while you were in fellowship? Or did it have like special challenges?
I think as far as being pregnant and being a doctor are concerned, that was probably the easiest way that I could have done it. Looking at being pregnant during med school or residency or fellowship, or early on the job. So I did take 3 months maternity time. I did extra kind of, they weren't exactly chores, but extra work before then, so that the other couple of fellows that I was working with would not be as overburdened by my being gone as they would have been normally. But I took my 3 months and then was able to restart, and it really didn't have an impact on how my training went.
Do you think having a child would be best saved for like around fellowship time for medical students interested in having a family? Or
what I tell people now is you should start your family when it's right for you. and don't try to fit it in with your medical career. There is no good time to have a baby.
Yeah.
And if that's a priority of yours, you just have to do it. And people will be inconvenienced, but that's life. And otherwise, you may risk not having a family. And I had my daughter very late with respect to my biological clock, and it didn't feel like it at the time, but the clock was definitely ticking, and I actually feel very lucky that I have her.
Are there particular challenges that women in medicine face even now? And maybe you could talk about that and perhaps ways you could resolve that. It seems like you've served on prestigious positions like being chief resident. I'm not sure if you had to maybe work extra hard to achieve those positions, or do you feel like wherever you were at, it was pretty much an equal playing field? What are your overall thoughts?
When I was in medical school and residency, I really did not have a sense of a gender gap there. I think that was partially because of the administrators of the program. They really were excellent mentors, and they really set the tone, they set the culture for our situation. And then on top of that, you're so busy that really all you have time to do is to do your job. As things have progressed, I think there is definitely a gender gap. It's definitely not as overt as it was 50 years ago when a woman would consider herself lucky just to get into medical school. But it is there, and so it requires an extra amount of asserting yourself, probably working longer hours, putting extra time in to get to a top position equivalent to where men are at. And I still will look around at committee meetings here at the school, and I can be the only woman there, even though they are hiring more women here. So the gender gap is definitely still there, and I'm assuming that with time that will get pushed until, I don't know if it will be made equivalent at any time, but probably not for a while.
Okay, but you think it's moving more towards that, though?
I think so. Yeah, it's just that was one surprise I had when I got to the university, is that it's not as, there's still some work to do, which I hadn't realized.
How has medicine changed since you started practicing, and where do you see it going in the future?
Well, medicine's changed a lot. When I started medical school, I anticipated probably be working in an office with a small group, working hard, but having it not be crazy, having a lot of autonomy. And that might be the big difference in what I was expecting and what I ended up facing. I think physicians have lost a lot of autonomy. I think physicians have relinquished it to a certain extent. So determining what patients you want to see, when you want to see them, how frequently, has been lost in a lot of situations. There are a lot of regulations that need to be followed, which are very time consuming, and or people haven't come up with a better way of dealing with the regulations. And the computer age has probably been the most impactful, in that physicians spend more time on the computer than they do actually working with patients.
You mentioned physicians losing their autonomy. Who has taken that power? Is that the bigger groups, or like government, or insurance companies, or all of them?
I think it's all of the above, and kind of my mantra is it's always the people who have the money, who have the power, and so you need to look at who has the money. With the University of California, then I guess ultimately that's the Regents of California, and they sort of set the goals, and then that filters down. I think that there is a very, in my opinion, maybe top-heavy administrative level that is dictating policy. And then you have doctors, and I think doctors by nature don't particularly want to deal with that aspect of life. They really do just want to see patients. And so they put up with stuff or, try and ignore it, and then all of a sudden things have changed a lot more than they really had realized.
Would you choose the same career path again? Is there anything you'd change about it?
Yes, I would choose the same career path. I love practicing medicine, and I love being an endocrinologist. I might work towards being in different job situations if I had it to do all over again. And there's a difference between practicing medicine and the job you have.
So what other types of jobs?
I don't know. Possibly setting up my own group with compadres of mine when we were first out of training, which is the time to do it. Possibly moving to a different state where practicing medicine is different. Okay. I'm not sure.
Last question. Any advice for medical students, current medical students, future medical students, maybe even residents, on how to become a good doctor?
Retain your curiosity. A mentor of mine actually wrote an article titled Curiosity, and I leave it at the bottom of a pile of paperwork that I sort through every few months, and then I'll find that article and it will remind me of that you've got to remain curious, because that potentially is the driving force for you to figure out what's going on with the patient, figure out how to take care of them, and to keep you moving forward. If you lose your curiosity, then I think it would be very difficult to be a good doctor. And of course, being compassionate and empathetic, and all of those qualities, which you don't have to be a doctor to utilize. But I think curiosity is fairly important.
Okay. So that concludes our interview. Thank you again, Dr. Hoffman, for being part of this interview.
Thank you.
If you have any questions for Dr. Hoffman, you can leave it down below in the comment section, and I'll ask her and relay that back to you. Let me know also down below who you'd like me to interview next. And thank you guys for watching.
Thank you.